All right. So I get asked a lot of times, what's the difference in the different peptides for growth hormone? One of the things you have to start off with is, and you might have seen this if you're doing research, there's kind of two different CJC 1295. So there's with and without DAC. DAC is drug activating compound. And what that does is it radically increases the half-life from like 30 minutes to like 7 days. The downside to that real quick is that while it does hold a, per shot, per milligram, per whatever, it does hold a much higher release of growth hormone because it's so much longer, but it completely eliminates the physiological function of the pulsative effects, the way your body usually does it, the way your body's used to it. So kind of keep that in mind. Now, if you're comparing them all as far as which one helps produce the highest amount of insulin-like growth factor 1, you're probably going to see, you're always going to see CJC 1295 with DAC at the very top of that. Now, if you take the DAC out, which is what most people are seeing when they see CJC 1295, what you're going to see is that ipamorelin kind of beats out CJC. Then you go CJC, and CJC and 1295 and samorelin are very similar. There's going to be a little bit more here, a little bit more there. When you compare these two, what you have to make sure you're doing is you're comparing the same dosage. Because a lot of times you'll be like, oh, look, this one produces a little bit more, but you're also using a little bit more. So CJC, samorelin are fairly similar on growth hormone release, and then tesamorelin's at the bottom. So, I know a lot of people who love tesamorelin. If it works for you, fantastic. I'm a big samorelin fan. I love CJC as well, but we all have our little thing. One of the things that you get when you combine CJC 1295 and ipamorelin is that you get two different kind of ways that the body's being stimulated. And so you're going to get a bigger spike and a little bit longer function out of it. It's a great synergistic effect. And so, lots of people are going with the CJC 1295 ipamorelin. Out of the choices, that would probably be my number one. There's a samorelin ipamorelin blend that I like, but the CJC 1295 ipamorelin is a really great blend. They both fit very well in the vial. There's no interaction between the two peptides. It's a fantastic blend for production of growth hormone. We're seeing, up to 200% rise in IGF-1, especially if you're older. Now, here's the thing. When we start talking about how much more it produces and how great it is, if you're 50 or 60 and you're not producing any, it's amazing the difference. If you're 16 and you're producing a whole lot to begin with, you're probably not going to notice much. So dose function is going to be important on that one. But always remember that when you take these things, if the goal is to get IGF-1, you have to remember your body's going to use these to produce growth hormone from the pituitary. Your liver then turns growth hormone into IGF-1. So the healthier your liver is, the better your chances that you're actually going to get to that IGF-1 function. So again, those are going to be methylated B vitamins, those are going to be minerals. And I'm a big fan of just overall balancing the liver function in general and all hormone function in general. And the best peptide we've seen for that is going to be retatrutide. So I know a lot of people talk about retatrutide for fat loss, and it is phenomenal at that. I'm not trying to knock that at all, but for my longer term function, if you lose 30 pounds and then you get off, you're missing the boat on Reta. The big thing on Reta is it's going to help balance everything, get that insulin glucagon ratios back where they're supposed to be, and make everything work better, including some of your growth hormone analogs. But as far as that goes, because people ask me all the time, which one's stronger, which one's better, which one should you do? You should do the one that you feel like helps you the most. But as far as order of production of growth hormone that turns into IGF-1, the stack that you're looking at is going to be CJC with DAC, then ipamorelin, samorelin, tesamorelin. If you're going to go without the DAC, which is what most people see, and which I kind of like that one more because of the, again, physiological function, it's going to be ipamorelin, CJC 1295, roughly equivalent to samorelin, and then tesamorelin at the end. Okay, if you guys have any other questions to this up, questions at chalmerswellness.com, or just drop them in the comments. Thanks for your time. Have a fabulous day.